My patient is a 78-year-old woman presenting to the ER complaining of feeling dizzy, tired, and confused. She has a history of hypertension and end-stage renal disease. Upon assessment, I discovered she has a stomach bug that's lasted a couple days, which has caused frequent vomiting and diarrhea. Ms. Smith, after analyzing your symptoms, I think that you're experiencing a fluid imbalance in your body, or dehydration is the more simple term for that. I'd like to talk to you a little bit more about that and explain what's going on in your body, what caused it to happen, what we can do to fix it, and how you can prevent it in the future. Let's talk a little bit about a process in your body called homeostasis. Homeostasis is the body's way of keeping things balanced inside the body. If a problem is found, it will make changes to reverse the problem back to normal. Some things that our body monitors are blood sugar, temperature, blood pressure, and fluid levels. When the body is unsuccessful at keeping that balance, it can lead to some uncomfortable symptoms, illness, and even death and extreme dehydration. Just a side note, you're nowhere near that point of dehydration. You can think of homeostasis like a thermostat, in the same way that the thermostat makes changes when the temperature is too high or too low. Our body's homeostasis mechanisms make changes when something like the fluid level is too high or too low. So let's talk more about fluid balance. We'll start off with a little mini science lesson to just get more into it. Inside our body, we have fluid outside of our cells and inside of our cells. The fluid that is outside of our cells delivers nutrients to the other parts of the body and carries waste to be thrown outside the body. It also carries white blood cells, which your body needs to fight off infections. You can think of the fluid outside of the cells like a highway or a road that goods and products can be carried on and delivered to a different location. Now, the fluid that is inside our cells contains everything that the cell needs to function, like nutrients, like potassium, sodium, and gases like oxygen. If those levels become unbalanced, the cells will not function correctly. With that knowledge in mind, let's go back to homeostasis. One of the nutrients that we need inside of our cells is called sodium, or salt. If there's too much salt in the cell, the body will dump it into the fluid outside of the cell. If there's not enough salt in the cell, the body will pull it into the cell from the fluid outside of the cell. And it's trying to make the level on the outside and the level on the inside of the cell equal. When the amount of water decreases but the amount of salt stays the same, it's becoming more concentrated. When the brain realizes that there's a problem with the salt concentration, it sends out a message to the other body parts. For example, it'll tell the kidney to hold on to the water to slow down the amount of fluid that your body loses. The brain sends out a message that makes you feel thirsty to increase fluid levels. It'll also affect your heart. Because there's less fluid, there will also be less blood in your body. That means that there will be less blood for the heart to pump. The blood is thicker as well because it's more concentrated with salt. So with the lower level of blood and the thickness of the blood, your heart will start to beat extra fast and try to make sure that it's still pushing out the blood and nutrients that it's supposed to be pushing out. So that gives you that racing heart feeling. Dehydration also affects your body temperature. When the brain realizes there's a problem with the salt concentration, it stops your body from sweating so the body can keep that water. Blood flow is another way that our body releases heat. When we're dehydrated, our blood flow decreases and does not let that heat out of the body. So these two factors cause our temperature to rise. So like it could give you a fever. And like we talked about earlier, when you're dehydrated, that also means there's less blood. Less blood means less nutrients and gases that are being delivered to the organs in our body. One example would be the brain not receiving oxygen, which is what would be causing you to feel dizzy, tired, maybe get a headache. Okay, so you're probably wondering why this happened. What did you do to be dehydrated? So you do have several risk factors that can cause your fluid levels to be imbalanced. Diarrhea and vomiting you've had the last couple days cause you to lose fluids very quickly. And then your end-stage renal disease and hypertension also has an effect on how well the body can maintain the fluid levels. So treatment. So while you're here, we can give you medicine to stop the nausea, vomiting, and diarrhea. We can give supplemental oxygen to all of your organs, like your brain, and that'll get the oxygen level up so you won't feel dizzy anymore. And also, you need to drink fluids. You can technically drink any drink, but water is preferred because it hydrates your body more efficiently than, say, something with a lot of sugar, like sodas or caffeine, coffee, energy drink, that kind of thing. And then also fruits and veggies have a high water content. So here's some examples of some fruits and veggies with high water content. And if for some reason you're unable to eat or drink, we can give you an IV with fluids, and that'll put everything your body needs directly into the bloodstream. And while you're here, your healthcare team will be monitoring your input and output, your blood work, and your vitals. And once we've got you feeling all better and you're back at home, there's some changes that you can make to prevent this from happening again. First thing, I'm sure you're expecting, drink water. It could be helpful to find a water bottle that you like. Sounds silly, but something that you're excited to use. And just keep it with you at all times. Keep it full. Most places have water fountains that you can fill it up with. And then just take a sip whenever you remember to. Whenever there's a commercial on the TV, just on the hour, just as much as you can, basically. And then just make sure you're paying attention to that feeling that you get of being thirsty. Your body's telling you that it needs water. Just remember to pay close attention to that feeling. And then you already know this now, but if you do get sick again, just make sure you're drinking even more fluids than you normally would be, because your body is losing fluids very quickly when you're sick. And then this does sound kind of weird and gross, but keep an eye on the color of your urine. If it's like dark yellow, orange, that means that you're dehydrated and you need some water. Our urine should be like a pale yellow, straw kind of color. And then avoid being in high temperature. It just causes you to sweat and you're losing fluid that your body needs. Dress for the temperature. If you're like me, you like fall weather and wearing sweaters all the time, but unfortunately in the summer that should not be done. So yeah, dress for the temperature, wear short sleeves in the summer, and we can wait for fall to come around to wear our cute sweaters. And then last of all, just pay attention to what your body's telling you. Make sure you're listening to it. All right. And then do you have any questions, concerns? All right, perfect. Well, let's get you started with some of that treatment and get you all feeling better.